Most people don't think about medical shortages until something runs out. But some households are already preparing for it, long before anything actually happens. And the reason isn't panic. It's pattern recognition. Because if you look closely, the signs have always been there. At first, it's subtle. A medication that's suddenly harder to find. A pharmacy that delays a refill. A supply that used to be common, now limited. Individually, these moments don't seem important. They feel temporary. So most people ignore them. They assume the system will correct itself. But others don't see it that way. They start asking a different question. Not, when will this go back to normal? But, what happens if it doesn't? And that question changes how they behave. Because once you consider that access might not always be guaranteed, you stop relying on convenience. And you start thinking in terms of continuity. That's when the first shift happens. Instead of reacting to problems, people begin preparing for them. They don't wait until something becomes urgent. They try to anticipate it. So they start small. They make sure they have basic supplies at home. They keep medications they regularly depend on. They pay attention to what runs out quickly. Nothing extreme. Just controlled preparation. But even here, most people run into a problem. Because preparation without understanding creates a false sense of security. Having supplies doesn't mean knowing how to use them. Stockpiling doesn't mean being ready. And this is where many people stop. They collect things, but they don't build clarity. So when a real situation happens, they still hesitate. They still question their decisions. They still feel uncertain. And that's where a deeper layer starts to matter. Because the real reason some households prepare isn't just fear of shortages. It's awareness of dependency. Modern healthcare works because everything is connected. Supply chains, pharmaceutical production, distribution systems. Most medications come from a limited number of sources, which means disruption in one place can affect everything else. But this connection is mostly invisible. People only notice it when something breaks. And when it does, the response is rarely immediate. There's delay, confusion, uncertainty. That's when shortages become real. And that's what some households are trying to avoid. Not the event itself, but the moment of being unprepared. But here's where things get more interesting. Because the real issue isn't the shortage. It's how people think about it. Most people treat medical access as guaranteed, so they never develop alternatives. They never learn how to manage conditions on their own. They never understand what actually matters in a situation. So when access becomes limited, everything feels urgent. Even things that could have been handled differently. The real issue isn't the lack of medicine. It's the lack of structure in how to deal with health problems without it. And that's the turning point. Because once you understand that, preparation stops being about accumulating things, and starts being about reducing uncertainty. You begin to ask better questions. Which conditions require immediate action? Which ones can be managed at home? What signs indicate something is getting worse? And that changes everything. Because now, instead of reacting emotionally, you evaluate. Instead of over-preparing blindly, you prepare with intention. And instead of depending entirely on the system, you create some degree of independence from it. This doesn't mean rejecting modern medicine. It means understanding its limits. And being ready for moments when it's not immediately available. Because those moments don't announce themselves. They build slowly. And by the time most people notice, options are already limited. But for those who prepared differently, the situation feels less chaotic. Not easy, but manageable. Because they're not starting from zero. They already understand the structure behind what's happening. If you want a more structured breakdown of how to think about medical shortages and what kind of preparation actually makes sense, there's a practical guide in the description that goes deeper into this. You can also subscribe if you want more videos that break down real-world problems in a clear and realistic way. Because when it comes to situations like this, preparation isn't about fear. It's about understanding.